Interns, please make some noise for today's special guest professor, the one and only
Limits, Devon Larratt.
Today, with Devin at the helm, we're taking a deep dive into the world of arm wrestling to see what we can learn about human anatomy. On the table, Devin is a force of nature, tireless, unrelenting, explosive.
He could pin Ryan right now. If he wanted to pin, he could pin.
Devin doing a lot of talking here, trying to get right into there saying, fight me.
And it is no surprise that the techniques and training methods that allow him to shine in battle have been cultivated meticulously through trial, error, and plenty of first-hand experience. It was an absolute pleasure to interview Devin. That video is soon to be live on my podcast channel for those interested in more in-depth discussion, and I will be sharing my favorite clips here today. He'll help us clear up some common misconceptions about the sport.
There's many schools of thought, okay?
Yep.
And if you talk to 100 arm wrestlers, probably quite a lot of them will tell you that it's rotational. Mm-hmm. Okay? I'm smarter than they are.
Hard to argue with results. And together, we'll take a look at the injuries that are most common among arm wrestlers, the tissues and structures involved in this nuanced form of combat, as well as how to grow and strengthen them.
Easiest way to tell if your hands are massive enough to become a good arm wrestler. Get your standard protein tub, right hands.
A process which Devin has obviously mastered. And for the record, when I shook his hand, why does my hand feel like a baby's hand compared to yours? We'll also discuss the way of the giant pumpkin, the unique training method Devin developed in order to grow his right arm beyond conceivable limits.
I'm good. I'm just gonna go and check my mail over there.
You been lifting weights?
No.
Buckle your seatbelts, we've got a lot to cover. Now, in a sport where the goal is simply to force your opponent's hand or forearm to touch the table, the average observer or amateur participant is ignorant to the level of complexity that is involved, which can lead them to attempt higher risk maneuvers that may result in a serious injury. Anyone remember when Aiden Ross's bodyguard broke his arm in an amateur bout against Zayas? In the context of arm wrestling, big muscles mean very little without an understanding of the relevant alignment and movement mechanics. Hopefully, this clip saves someone a trip to the ER.
There's a process of shoulder alignment. The thing that really breaks you is spiral pressure. Mm-hmm. Okay? Now, arm wrestling breaks happen in all sorts of positions. People say, oh, it's this position. No, it happens all over. Okay? Mm-hmm. But the thing that's really causing it is this spin. Basically like when you're throwing a ball. Yep. Or like in martial arts, a key lock, like when they grab the wrist and they start. Like you're trying to throw a 1,000-pound ball and it's not
moving and you're cranking it.
And that spin through the body has to translate through this bone. Mm-hmm. And we're not really designed to throw things that are 1,000 pounds.
Yeah. This strikes me as a very important place to start. Devin is referring here to the greatest weakness of human bones, rotational force. We have evolved to stand upright, our bones bearing the weight of the body under gravity as we move throughout the world, as well as to perform basic mechanics such as squatting, pushing, walking, pulling, and hanging. When engaged in these basic mechanics of human movement, bones bear axial load with the force applied along the length of the bone. Axial load can be compressive, with force applied to the ends of the structure, or tensile when something is being pulled or stretched. Throughout the process of evolution, these are the forces bones evolve to withstand, with an emphasis on compression because of the structure required to resist gravity. Keep in mind, the first vertebrate lived some 450 million years ago and took to land approximately 390 million years ago. So, it's been a while. Even when the human body rotates, it is our connective and muscle tissues that really enable it to do so, while the bones retain their rigidity. To simplify, the structure of our bones is like a bundle of pipes bound together by rigid plates. When rotational force is applied directly to this bundle, the individual pipes tend to break apart and separate at their connecting points, compromising its structural integrity.
And that's always the same It's a spiral fracture.
Yes.
Just right above the elbow joint.
Yeah.
Happens all the time.
Yeah.
Happens a lot with new guys.
Okay.
People in arm wrestling try and like be like, oh, no, it's bad.
Yeah, no, for sure.
Yeah, people be popping their arms arm wrestling all the time.
Professor Larratt is referring to a spiral fracture of the distal or lower third of the humerus, also known as a Holstein-Lewis fracture. Distal meaning situated away from the center of the body or the point of attachment. A 2021 systematic review of the available literature on arm wrestling injuries published in the Journal of Clinical Orthopedics and Trauma showed that these fractures are by far and away the most common injury reported in the setting of arm wrestling. With the hand locked in battle and the elbow pressed against the table, the location of the shoulder in space will determine how much force is translated through the humerus, which fails due to torsional and bending stresses. I'll let Devin speak to practical strategies to mitigate this risk in a moment. Unfortunately, researchers in the aforementioned study found further complications where 23% of those with spiral fractures suffered a concomitant medial butterfly fragment, and 23% had an incidence of radial nerve palsy. A palsy is a lack of function of a nerve, and here the radial nerve is at risk as it traverses the spiral groove to the lateral intermuscular septum. In regards to fixation, the same study showed an approximate 50-50 split between operative and non-operative methods. While non-operative treatment with a functional brace or cast avoids all the potential complications associated with surgery, the likelihood of anatomic positioning once healed is reduced and the duration of time required for healing is likely to be longer. On the other hand, surgical fixation is much more likely to produce anatomic alignment and a shorter overall healing time, but at the price of the risks and possible complications that are infrequently associated with surgery. But obviously, the healthiest option is prevention. Luckily for us, there are a couple simple cues that can help the amateur arm wrestler avoid spiral pressure.
As soon as you start to come forward, you're likely going to start to have spiral pressure more. Not that you can't have it outside, but more likely. If you're going to come forward, what you want to do is you want to be behind your arm. Okay, so it's a push as opposed to here, a spiral. Okay, so this bad, this good. And don't arm wrestle if you don't drink a lot of milk and work out. Like, don't be doing it. It's crazy.
That's right, man. Devin also mentioned that keeping your eye on your hand will help you track where it is in space so that you can keep it inside the shoulder more effectively, as well as several other things.
Get with a club. Get with a club. If you're interested in the sport of arm wrestling, know that you can hurt yourself. You will hurt yourself.
And like with any martial art, there are specific movements that are central to the practice.
Learn the basic exercises. This rising, it's a variation of a curl. Just basically, instead of curling, you're putting more emphasis in this upwards movement.
Okay, yep.
You have the variation of a curl through the thumb. So you're curling, but you're using your thumb as with a belt.
Yeah.
And then you have just basically rowing with an emphasis on your wrist.
Yeah.
If you do those three things, you're going to just start to feel these movements and they're going to become natural to you. And then when you get an arm wrestling table, you're going to do these and you're going to feel it very easily.
As you'll see, each of these movement patterns do one or two things: exploit a weakness in the opponent's anatomical chain or put you in a position to take advantage of your own anatomical strength. In the arm wrestling community, these movements are known as rising, cupping, and rolling. And they are the foundational patterns upon which good arm wrestling is built.
Rising, cupping, and rolling. RCR, rise, cup, roll.
The RCR techniques are central to Devin's training, and we'll need to discuss each one in a little more detail.
There's this rising chain,
yes,
this upwards drive.
Yep.
This dictates everything. Whoever has more rise has more efficiency, has more technical choice. The other person has to hold on to, everything falls apart. Whoever wins the rise basically wins the match.
This rising motion, as Devin mentioned before, is a modified version of a bicep curl, involving a combination of radial deviation at the wrist joint and flexion at the elbow joint. The extensor carpi radialis longus and brevis are a pair of muscles located on the side of the forearm that control extension, or in this case, radial deviation of the wrist. The curling motion involves the biceps, the brachialis, and the brachioradialis. The biceps biceps, formerly known as the biceps brachii, a Latin phrase meaning two-headed muscle of the arm, employs two bundles of the muscle originating separately at the glenoid and coracoid process in the shoulder and converging into one large muscle belly before attaching at the upper forearm. The biceps is a combined elbow flexor and supinator of the wrist and forearm. The brachialis is the prime mover of elbow flexion, generating significantly more power than the biceps, while the brachioradialis contributes to pronation, supination, and elbow flexion, depending on the position of the forearm. Here's an example of how to train these muscle groups.
Have the belt so that it's in between your punch-in knuckle and your first knuckle. If you wanted to stand, do reps, hold, rest on a bench, rise up.
When locked in battle, the movement is subtle. In this friendly match versus Matt Mask, a powerful arm wrestler in his own right, watch as Devin locks his bicep in place, fights to keep his hand in an abducted position, and leans away from the table to create the rise effect. I stumbled upon this 11-year-old instructional video in my research.
Bicep is locked and you're driving up, okay, through these small muscles which are also locked, okay? What's gonna give? Either your hand is gonna drop, your bicep is gonna open. This is how you know your rising has been compromised.
He's been refining this technique for a long time. And before we move on, it is important to note that when the muscles are locked in a contracted state, the tendons are required to bear load in a way that they normally would not be. Let me explain. Generally, muscles are designed to contract and relax. We pick things up and we put things down, as the rigid tendons bear load for the duration of the exercise. Here they are taxed with higher tension than normal for a longer duration of time. This is exacerbated by the fact that there is no true eccentric phase of the exercise at the arm wrestling table. It's like one big curl, but your arm is stuck halfway up by a very large weight. In most exercises, there is both a concentric contraction wherein the muscle tension rises to meet the resistance, then remains stable as the muscle shortens, and an eccentric contraction where the muscle lengthens as the resistance becomes greater than the force the muscle is producing. The result is that the arm wrestling stresses connective tissue to a greater degree than they are accustomed to.
When I was young, old arm wrestlers used to say, "Oh, Devin, this is a tendon sport. It's a ligament sport." And I never really understood it because I'm like, the muscles are doing the work here. Like, what? Like, I mean, but you don't notice until the tendons and ligaments become an issue. And then you realize, okay, this is what's holding me back.
Muscles and connective tissue, tendons and ligaments, require different training stimuli to reach maximum potential. As we'll soon see, Devin's profound understanding of their unique requirements has informed his training method. But we haven't finished with RCR. Devin, can you tell the interns what good rise technique allows you to do?
It's just about attacking weakness.
Okay.
The weakest part of this whole system is the fingertips. So when we arm wrestle, I'm just pulling up. I just pull up into your fingers.
Okay.
That's it.
Because that's the weakest part of the chain.
Yeah.
Professor Larratt is correct. And in fact, the muscles that are responsible for the movement of the hand don't even extend into the fingers. They are subdivided into two groups. The extrinsic muscles, so called because the muscle belly originates in the forearm, and the intrinsic muscle groups consisting of smaller muscles located solely within the various hand osteofascial compartments within the anatomic confines of the wrist, proximally, and the phalanges distally. The complex movement patterns available to our hand and wrist rely heavily on tendons located there and extending into the forearm. An arm wrestler's connective tissue is accustomed to hard work.
The most important part of arm wrestling, the cup, okay?
Which is true for several reasons, which Devin alluded to in our interview.
With this strength we call cupping, wrist flexion, but it's a chain, right?
Yep.
But this is not this.
Yeah.
Okay, this is all, you're designed to do this.
Right. I appreciate that Devin refers to cupping as part of a movement chain. While there is an emphasis on wrist flexion, which is achieved through flexicarpi radialis and flexicarpi ulnaris, and activation through the biceps, brachialis, and brachioradialis as previously discussed, this rowing motion also activates the larger muscles on the back of the body, latissimus dorsi, rhomboids, and the deltoids.
Standard thick spinner. This is actually from Juji. You can do holds or you can do reps. where you burn out your wrist.
These muscles are substantially stronger than those in the biceps or the forearm, allowing him to generate greater force as displayed here in a recent training video where Matt Mask uses 2 hands to push Devin beyond his limits. Watch closely. Devin works to flex his wrist as he gains position on the table.
Stay with it, Devin. Yeah, I got it now. Yeah, you do.
Devin chooses when to train maximal capacity very wisely. In this case, he is preparing for his upcoming bout with Gennady Kivik, peaking soon before he takes several weeks off. With experience under conditions like this, most opponents stand no freaking chance.
It meets in the center, but look at Yevgeny Prudnik's face. He's not applying all the power because he knows that it's done. He's lost all the fundamental position.
You'll notice that as Devin cups deeper, Evgeny's hand begins to turn upwards and the wrist moves into slight extension.
When you think of doing this to your opponent, what that does is it turns their palm up.
Our muscles are more powerful when contracted. It is literally by contracting that they generate force, leaving them mechanically disadvantaged when in a lengthened position. A good cup technique shortens the length of the opponent's lever by way of extending the wrist, and simultaneously lengthens your own lever by way of wrist flexion, thereby combining the length of the hand to the forearm length. As Devin leans away from the table, he manipulates his body angle to engage the larger muscles in his back, effectively pulling or rowing his opponent's arm towards the table. The alignment of his anatomy allows him to generate great force.
Rhodes in a somewhat of a balanced
Too out of shape already. He's got no purchase.
Devon Larratt in control once again.
In this example, Professor Larratt uses cupping to shorten his movement chain and pull his opponent towards him, thus controlling the table. He's like a boa constrictor, slowly eliminating movement options of the opponent until the pin is secured. Finally, we have a technique known as rolling.
There's this pronation chain. I always like to show this, right? So that's the ability to turn your palm over, right?
Devin's extremely developed pronator teres muscle allows him to pronate his hand in the heat of battle.
Really, it's not so much pronation, it's not getting turned over. So you need to be really strong like this.
Resisting the opponent's attempts to supinate the forearm and palm, turning them up towards the ceiling is absolutely integral. It looks like Evgeny would have benefited from a better roll defense here.
Running over the back of your hand, something like that. Take up the tension with your thumb and curl it up.
As Devin has shown us, there are simple ways to train the RCR movement chains. But even with world-class strength and excellent technique, a professional arm wrestler always runs the risk of injury.
My right arm by 2012 was a disaster. I had multiple surgeries. You pick something that's wrong with an arm and I had it.
Many of the injuries that pertain to arm wrestlers occur in connective tissue. Remember earlier when Devin said it was a tendon and ligament sport? In my research, I came across case reports for injuries at just about every point in the active arm. Rupture to the subscapularis tendon in the shoulder, rupture to the medial collateral ligament of the elbow, rupture to the triceps and biceps tendon, and even rupture to the ulnar collateral ligament of the thumb. There's a trend here. I know it. A rupture of a tendon or ligament describes a partial or full thickness tearing of the tissue's fibers. These injuries are acute in nature, generally occurring when a tissue cannot sustain the force placed upon it by, say, a monstrous opponent at the arm wrestling table.
This is an F1 car. Right now the road again. Bumpy big drag. It's oceans ahead. What concerns me is did some injury occur?
Early on in this match against Levon, Devin tore his biceps tendon. This injury occurred on June 25th of 2022, and obviously since then, Devin has made an incredible recovery. In only 9 months, he has managed to restore the functional range of motion and strength of his affected arm and return to fighting form. This is enough time to allow the injured muscle tissue to heal and be rehabilitated, and for the tensile strength of the connective tissues in ligaments and tendons to be restored. By this point in his career, no injury will keep him down for long, as he is no stranger to injury.
So my biggest ones are chronic. They're a result of, just too much for too long without enough recovery or whatever. Most of my bad stuff is arthritic changes, just due to joints being under a lot of pressure. That's straight.
Arthritis like this often requires surgery in order to replace ankylosed or seized joint surfaces that have lost their articular cartilage and their ability to move. This is a degenerative change that Devin will need to manage actively in order to retain the level of movement to which he is now accustomed and delay the inevitable outcome of the degenerative process. Thankfully, he is proactive and continues to devote the lion's share of his energy to rehab and prehab, as he has for quite some time. He changed his approach drastically after watching the documentary called Strolling Under the Skin.
And that's where they went in with microscopes. They observed the fluid movement through the structures.
Yeah.
And they realized that they only feed when they move.
Yeah. Devin is referring here to a process called perfusion, which refers to the bathing of an organ or tissue with a fluid such as blood. This is especially important to tendons and ligaments, which have a very poor blood supply because they do not have any blood vessels that travel through them. On one hand, a lack of blood vessels increases tissue strength and rigidity, while on the other hand, it also reduces its ability to heal. A 2002 article from Arthritis Research tells us, the vascular supply to the tendon has been shown to arise from 3 distinct areas: the musculotendinous junction, the osteotendinous junction, and vessels from various surrounding connective tissue such as the peritoneum, mesotenon, and vincula. When you move, blood perfuses over the tendons via these pathways.
Start to get an understanding of the difference between training ligaments and tendons as opposed to training muscles.
Muscles, on the other hand, receive blood directly via arteries and smaller blood vessels that run through them, allowing them to heal much faster. Since training a tissue involves stressing it and then waiting for it to heal, connective tissue and muscles must be approached differently. Or, put more directly, connective tissue primarily receives the blood it requires to heal when you move.
Today, Cody is Monsieur Fascia, okay? And I'm going to torture him.
Whereas a muscle receives it passively when you are resting.
I started to change the way that I train just to feed my connective structures. Not even going for performance and just feed the structures.
Devin is constantly moving with low intensity exercises.
My rehab really took on a life of its own. It was long ago, so I've been focusing on rehab for over a decade. So rehab is probably one of the biggest pieces of it's probably what I spend the most time on out of all the blocks.
But this is not the only thing that sets his training apart.
Basically, exercises and training systems fell away until a transition point about 3 years ago. I call it Way of the Giant Pumpkin.
Okay. Explain.
Do you know about giant pumpkins?
No.
You never seen giant pumpkins?
No, I know what they are, but I don't know anything about them other than they're huge.
Right, they're massive.
Yeah.
Right. Okay, so that was my goal. Okay. Right?
Yeah.
To make one giant pumpkin.
Okay.
Okay, so what I did was I pinched off all the other flowers on the vine.
Yeah.
Okay, and I was left with only one thing. It's my right hand.
Devin is a pure specialist with absolute focus, pouring the majority of his time and energy into his right arm. Whether it be practical application of the sport while on the table, focused strength exercises, or prehab and rehab. Anything not related to crushing his opponents on the table with his right arm, he simply does not do. This has led to a size imbalance between his right and his left arms. Kind of like Hellboy.
Does it fit in? Oh, yeah. But right hand.
And onlookers are continually surprised that his main weapon seemingly continues to grow in size. Look no further than YouTube.
Do you see something? This arm is longer. Do you see that?
He is a living experiment. I mean that in the most admirable way, in muscular and tissue adaptation.
Yeah, man, you need to feed your tendons and ligaments.
And feed they have. In fact, it would seem that his arm and hand are growing in length and size. all of the tissues involved. In the podcast, we discuss why this might occur in a little more detail, but there's no denying that Devin is onto something. Hell, he even appears to heal his injuries at superhuman speed. Did he say his name was Logan or Devin?
I had surgery, and I was on an arm wrestling table, I think 2 days after my surgery.
Okay.
I tore my bicep, and 8 days later I was on the table arm wrestling. Now, I'm very responsible. I'm not being an idiot, right? Yep. I'm on that table and I'm just doing what I can.
Sure.
That's it. And I tell my partners, it's a lot about communication, you know. Some therapy is done as an individual, some, you know, you do together. And at that point, you know, communication is super important. Talk to them, have them be nice to you.
Does it come as a surprise that this is music to my orthopedic ears? As a surgeon, I strive to get my patients back to reasonable levels of activity as soon as possible, and hope that in that process they have the intuition to listen to their body.
Now I just listen to my body so much, and if it doesn't feel good, I don't do it.
Okay.
You know, and if it feels good, I'm happy to do it.
No need to overdo it. Movement is medicine, and Devin is living proof. It was an absolute pleasure having Professor Larratt on today's episode, and I wish him all the best in his upcoming match versus Gennady.
Oh, Gennady, oh, you're gonna kill him. He's got little baby hands. Oh, you're gonna murder him. No, Devin, you don't even need to train.
I'd say Devin already has an upper hand on account of all his tactical trash talk. Don't forget to follow my online gym, Human 2.0, for free, right here on YouTube, to move better and prevent injury. And I'll leave a link to the full podcast with Devin down below. If you enjoyed the video, be sure to give it a thumbs up and subscribe to the channel. If you didn't, be sure to let me know why in the comment section down below. And as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.